disproportionately impacted by low birth weight, wealth gaps, homelessness, disparities in kindergarten readiness, and a long list of outcomes. And we want to help raise awareness of that in the community. The short-term objectives of this campaign, like I said, really include raising awareness, and it's about lifting up partner work. There is so much really good work happening in the community, and we want to help make other folks aware of that and understand what is working well and what we need to do more of. Long-term objectives include advocating for policy change and building a more equitable early childhood system. Ultimately, that's what we're after here. The campaign assets, we have a website, normalwasneverenough.org. We have written a series of blog posts, and we'll get into that in a little bit, talking about the topics that we've covered thus far. We have a social media campaign that's been going. And again, I know a few organizations, HealthNet and Family Futures definitely jump to mind, that have been sharing some of this information pretty regularly. So thank you for that. We've been doing regular segments on Shelley Irwin's show on WGBU. And we are working on some other things in the future: videos, outdoor advertising, guest editorials, and hopefully some things that we can think about and brainstorm today. And I am now going to hand it over to Katie, who's going to get into some of the issues that we've been looking at thus far.
Sorry, I got a new computer, you guys, and I'm having a hard time like adjusting to where all of the things are. So I promise I actually am tech savvy at Zoom. It's been a struggle today, you guys. So I want to go over some of the issues that we've highlighted. And one of those issues is family economic security. And I'm not going to read these slides to you because we're going to send them all out. And there's also blogs and resources on the page. But I just kind of wanted to highlight some things. According to ACS data, white families are making approximately $87,000 a year, while Latinx families are making $52,000 and Black families are making approximately $45,000. So if you look at that in another way, Black families are making 52 cents on the dollar for every white family. And you see we go into 35% of all households struggle to pay for basic needs. You see the graph here. The social media campaign, this is an example of one of the social media campaigns that Tyler and his team at Well Design designed. Each social media campaign has 5 to 6 different graphics that you post at one time, so you can scroll through. It's really good for Instagram if you're going to be scrolling through. It's really good for Facebook to click through. So this is just an example of one of them. And we also identified some action steps. You know, it's really easy to identify issues, but it's not always as clear cut to identify action steps. So for these ones specifically, we partnered with the Michigan League for Public Policy, and this is from the Kids Count report and 2023 budget priorities. Again, I'm not going to read this to you. This is again on the website, and we'll send this to you. But some action steps that we could promote would be to address income and tax inequality. And there's a specific bill to support. Meet affordable housing needs, which we'll talk about in a few minutes with affordable housing and homelessness, and to support families in deep poverty. One of the next issues that we worked on is birth equity. We know that there are very big racial disparity gaps for women who are birthing babies. Black mothers are 2 to 3 times more likely than white mothers to die in childbirth. Black infants are more than twice as likely to die before their first birthday or be born at a low birth weight. And while we see racial disparity gaps for Latinx mothers and babies, we see a bigger disparity gap for Black moms and babies. So this is just another example of the social media post. Again, there's 5 to 6 of these to scroll through. If you look at the dissemination guide that's on the website and that we'll also be emailing to you, we do have hashtags to use. We have sample social media posts that you can just copy and paste right into whatever social media platform that you use. So we have it really laid out for you. So it's really copy, paste, and go. Some action steps that we want to highlight is from MDHHS Mother Infant Health and Equity Improvement Plan. You can see the 6 steps here: program identification, assess key objectives, identify ways to improve communication and do innovation, engage with partners already doing the work, align programs, and report lessons learned. Another big issue that we're working on right now, and that we wrote a blog and did some interviews around, are childcare. We know that childcare, ever since, COVID especially, but always has been a real issue, is being able to afford the cost of childcare, high quality childcare for children of all ages. The other issue that goes along with it is that the median pay for childcare providers is really relatively low. Childcare is like the cost of a college tuition, right? And you have 18 years to save up for college tuition, but you have 9 months to start saving up and put into childcare costs. So this is a really big issue in our community. I know First Steps is working on it. Again, this is an example of one of the social media posts. And we pulled some action steps from MLPP's 2023 budget priorities. So you can see them here. One of them is to join Think Babies, and there's a link at the bottom so you could learn more about a Think Babies Michigan. Yeah, I would definitely recommend checking this out. It is a really big issue right now in the community. I know, yeah, I would definitely check this one out. And then this is one of the ones that we're working on right now. We haven't completely fleshed out housing security. It's the next one that we'll be presenting with a blog and some interviews. But we do have some data around it. K-Connect did a data analysis using HMIS and ACS data. And we just want to highlight that when we look at children ages 0 to 4, 1 in 5 Black children were in the homeless system in 2019, compared to 1 in 119 white children. So we are waiting for updated data on this. One of the issues is that COVID has kind of halted some data reporting. So if you do see blogs come out about this, the data might be a little different, but this is the K-Connect 2019 data analysis. And then we do have some action steps, again, from MLPP's homelessness and early childhood study, adequate data collection, which kind of goes along with what I just said, a coordination of services, early childhood education opportunities, and then to work on housing discrimination, which we see pretty prevalent in Kent County. So some future focuses that we're going to be working on is school readiness, kindergarten readiness, things like that. The KRA, the kindergarten readiness assessment, is no longer something that Kent ISD is doing. So some advocacy and blogs around that. Mental health and well-being. We see student well-being is something in early childhood that a lot of people are very passionate about, and we want to explore that. And then social determinants of health. And this is the logos and a summary of the team that's been working on this, as Amy alluded to. You see K-Connect First Steps well designed, but you also see the Grand Rapids Early Discovery Center, Great Start to Quality, ELNC, Great Start Collaborative Kent County, the Johnson Center, and then of course MLPP. So I'm going to turn it back over to Amy.
Okay, thanks, Katie.
Feedback.
Yeah, so we wanted to just open it up to any questions, any feedback, anything anyone would like to share based on the information that Katie has shared so far in the presentation. Our committee has come up with some tools. We're hoping to help make it easy to share some of the content that has already been developed, and Megan's going to talk about that in a minute. But first, an initial question, I guess, is, do you see this campaign aligning with your organization's work? And, don't necessarily know exactly what that would look like yet, but is this something that you think that there's a role maybe that you would be interested, or your organization would be interested in playing in this work? So we'll open that up to conversation if anybody wants to jump in. And also Paula, Tyler, and Tori from the committee, if you have anything else to share, please feel free to jump in. And just go ahead, unmute yourselves and talk. This isn't like pretend we're in a lovely room.
Well, I had a question. I don't know if you can go back to the slide where you were talking about some of the target audiences regarding getting the word out.
Yeah.
About the campaign. I want to take a look at that before I ask my question to make sure.
I don't think we have a slide on target audiences, but that's something our committee talked about a lot. So yeah, go ahead with your question and then we can
go back to, it's the slide that you just left, that one. So with this, who is the target audience, I guess? Like, who are you trying to, or who are we trying to appeal to with regard to this awareness?
Yeah, so I'll kind of summarize a little bit about, we had a lot of committee discussion on this and where we landed and who we've been targeting thus far. And then I think we're also very interested in your feedback as we move forward. But I think that the best word we used to label people initially was persuadables. People who are likely somewhat have some connection, maybe like are naturally empathetic to the information that we're presenting, and are people who would, this may be on their radar, but it is not something, they don't have the depth of knowledge necessarily about the issues and the disparities in the data, nor do they have the depth of knowledge on what's currently happening in the community to address these, and what could we do more of, and what could we do differently, and how do we think differently. So we talked a lot about this, and we felt like that was the best place to start, and was to really build awareness and support among those who are most likely to be supportive if they have additional information. And that isn't necessarily the end goal, but we felt like that was our best starting place. Does anybody else from the committee want to add anything to that? Okay, Angela, do you have any additional thoughts on that?
I did. I had a little bit of a follow-up. So keeping what you just said in mind, then what would, what's the ask? What's the objective with that awareness?
Yep, the asks are, I mean, first, we all felt like there is just value in being made aware. You can't care about a problem if you don't know it exists, and you can't get to the next step of trying to be part of the solution. So, so our first ask is just that people, our ask of the community, not of you here, but our ask of the community is that people, start to understand this better, that there are, in all of our blog posts and on our social media posts, we have connections to additional resources. So if there is something that particularly speaks to you, if you're really concerned about birth outcomes, if you're really concerned about childcare, you can learn more. If you're interested in policy solutions and what's being done at a local or state level in terms of advocacy, Michigan League for Public Policy and some other organizations provide quite a bit of opportunity there. So our first big ask is really just that people become aware. And like I said, we do have policy solutions in all of the material, or policy issues that in all of the material that we're putting together. But there isn't a, if everybody does this, like we're going to get there in a week kind of thing. So yeah, but that's a great question, because we wrestled with that a lot.
I'd also like to point out, I've had some questions about this campaign seems really political. MLPP is a nonpartisan organization, and this is a nonpartisan campaign. We're talking specifically about data, about policy, about things that are very tangible. So yeah, I just want to point that out. I've definitely received a lot of questions about that. And if you have any further questions, feel free to reach out to somebody on the team. But this is definitely a nonpartisan issue.
We've had a couple comments in the chat where people have said, yes, this does feel like something that is aligned with my organization's work. I mean, do you think so? And we'll get into this with Megan, and maybe we should do that first before we further the discussion. So Megan, do you want to go ahead and do your slides about some of what we've put together? And as Megan is sharing this with you, I mean, one thing we want to make clear is that this isn't necessarily prescriptive. Like, this is what we are saying we want everybody to do. We're trying to make some of it as easy as possible to share some of the content that's already been generated, but we also very much want to be on the receiving end of your suggestions and ideas and feedback. And we want to ask you, if and you don't have to have answers right now in this meeting, but if there are things that you think, oh, this is a great fit for my organization and we really have something to add here, our door is wide open, that we would love to have you engage in whatever way it makes sense for you. So as Megan goes through this, please don't look at this as this is what we're saying has to be done kind of thing. Go ahead, Megan.
Hi. So ways that we thought you all could get involved as communications professionals is you can join the team. We have, I think, maybe 10 people on the team now, but any more input is always welcome. You can share the content out, and I have a bigger ask of that next. You can contribute ideas. So a lot of the campaign also is lifting up Kent County work that's actually happening to reduce disparities. So for example, when we did childcare, we lifted up the shared services pilot project. And when we talked about birth equity, we talked about the fetal infant mortality review board and the day one doulas. So if you have something that you're like, our work is already addressing this, that's a good thing, and we can include it in some of the content. You can write a guest blog. We have our first one in the works. So Joel with the Delta Project is going to connect early childhood to his work, which is incarcerated teens, right? So tying that back to early childhood and lifting up that work.
Yeah. The continuum that these kids are going to grow up and are going to face things that none of us might want them to face, and understanding that this situation in early childhood can lead to a middle-aged person who's homeless, 35 years from now. So trying to look at that whole continuum.
So you can also write a guest blog that would go along with your work, like Joel is doing for us. And then advocating is just another thing that you could do. And on the website, I think I put it in the chat, there's a tab that's what can I do? And it has all the ways you can advocate for these issues. But the one way, the next slide, Katie, to share content is we came up with this, take the new normal pledge. So pledge to help create a new normal in Kent County where all children are living happy, healthy, and living their best childhoods. So we put together this pledge for whenever, but we were going to kick it off for Month of the Young Child, which is April. I think you can go to the next one. Maybe I'm just talking about all of it together. So for April, we thought an easy way for you guys to help us get this information out there. And it would be really cool for us to all be saying the same thing throughout the month about early childhood and how these disparities are affecting our young children. So we came up with a content calendar, and there's ways that you can, like Katie said, link to an article, link to the social posts, link to the blogs, and then we made it really easy for you.
I can pull up the content calendar, Megan, after you're done with the slides, if you want to maybe walk through that and see.
Let me just share my screen if that works.
Okay.
Oops.
So we we tried to make a version of this that's sort of add water and stir, if that's what would be most helpful to you. But we also want it to be very wide open, that we're very open to other ideas and to other ways of engagement. But if what's most useful to your organization is to have something that's just ready to go, we can do that.
So if you want to commit to taking the normal pledge, we will put your name on the website, your organization's name on the website, and then we'll have some posters and some other things available for the beginning of April. But ways that you can fulfill your pledge is to contribute your expertise, to share the social media, write the guest blog, write to elected officials, present the data to your board of directors, and include the link on your website. So they're just ideas. We're not going to make you do all of them, but if you do one or two, we'll put your name on the website as well. And then it's just aligning it with the month of the young child. We thought it would be a good opportunity to all be saying the same thing as we focus on young children. I think actually it's only week of the young child now, but it used to be month of the young child, and we're just going to call it month of the young child. So we can do the whole month. So week 1 is only April 1 and 2. So we had Rapid Growth did a nice write-up for us. So we suggested share that article, and then we put some accompanying text to go with that. Week 2, you can download the social posts. You can link to the blog. You can link to the radio segment. Oops. Where did it go? There it is. One good way to get the information out, and we don't mind if you just copy paste the content, is just copy paste it and make it your own blog, or send it as an email to your email list, which is fine too. And some more content to go with that. Week 3, same thing. And then week 4 and 5, same thing. So yeah, you don't have to do it the same day, or however you do your social media. It also is spring break during that time. So I don't know if you have a way to schedule things like that, but that's kind of our idea for the month of the young child.
Yeah. And
sorry.
yeah, go ahead, Megan. Keep
I was
going.
just going to say, I know that like Family Futures and HealthNet have already shared a lot of this stuff out. So thank you for that. But we figure this content isn't going to get stale. So it will be fine to keep reposting it over time.
Hey, Megan, I see you have the website pulled up. Could you go to the dissemination page?
Mhm.
Because in this content calendar, our just like 1 or 2 sample posts. But if you go to the dissemination page on the website, there's normally like 3 or 4, and all of this is on here too.
Yeah, right.
So if you're like me and you lose Google Docs constantly and you search and you have hundreds of them, the website has all of this information too.
Yeah, and just to clarify, so we're really hoping to broaden the reach of the campaign during April, but it doesn't end at the end of April. We will continue to generate content and continue to look at additional topics and issues, and hopefully have more engagement from you and your organizations. So it does not end at the end of what was a week, and now we've decided it's worthy of a month. And yeah, the idea with the pledge is really just to show that this is a broader community collective effort. It's not like we're going to be knocking on your door. Well, like, you have only done one thing. It's not that. It's to say that as organizations that are working to improve our community for our youngest children, we believe this is important, and we stand behind this work, is really the intent of the pledge. So, okay, so with that being said, we'll open it up if there are any additional questions, and we hope this isn't the end of the conversation. I mean, the purpose of bringing you together today was really to make you aware of this campaign, and to ask to see if you would like to be engaged in any way, whether it be sharing content, whether it be generating content, whether it be joining the committee. It can look a lot of different ways, and you can go back and talk to folks in your organization about the campaign and find out if, does your organization want to sign the pledge, that kind of thing, and get back to us. So yeah, we're hoping this isn't just the last time we discuss this with each of you. So if anyone has questions, thoughts, please let us know. Anything that we could do that would make it easier for you, anything else you'd like to know from us or from the